Welcome to the Deep Dive. Today, we're tackling hypertensive retinopathy. That's retinal damage from chronic high blood pressure.
Exactly.
Our aim here is simple. Pull out the key info you need for revision. We'll cover the definition, causes, right through to complications.
Yep, basically everything you need to know. It's crucial for understanding how high blood pressure affects the eyes.
And it's quite a visible sign of systemic issues, isn't it?
It really is. So let's start with the basics. Hypertensive retinopathy.
Hmm.
What is it exactly?
Okay, so fundamentally, it's damage to the retina, the light-sensitive bit at the back of the eye.
Right.
And it's caused by high blood pressure that's been going on for a while. This pressure damages the tiny blood vessels there, and, well, it can lead to vision loss.
And we grade it, don't we, using the Keith-Wagner classification.
We do. Stages I through 4 to sort of measure the severity.
So stage I, what are we looking for there?
In stage I, you'll see the arterioles in the retina getting narrower, maybe a bit more twisty.
Tortuous, yeah.
Exactly. And they have this increased light reflex, sometimes called silver wiring.
Okay, silver wiring. We'll get a little mnemonic for that. Skinny and wiggly silver veins.
Skinny, wiggly, silver. Got it. So stage 2.
Stage 2 adds something called arteriovenous nipping, or AV nipping.
Okay, what's that?
It's where the hardened artery presses down on the vein where they cross. It looks like it's pinching or nipping it.
Ah, hence the mnemonic. Artery nips the vein.
Precisely. Makes sense, right?
It does. Moving on to stage 3, sounds like things get more serious here.
They do, yeah. Stage 3, you start seeing signs of more significant damage. Things like cotton wool spots.
Which
They're
are,
like these fluffy white patches. They actually represent areas where the nerve fiber layer isn't getting enough oxygen, little infarcts, basically.
right, ischemia.
Exactly. And you'll also see hemorrhages, flame-shaped ones, blotchy ones, bleeding in the retina.
Okay.
And sometimes you might see exudates arranging in a star shape around the macula.
Wow, okay, so the mnemonic. Fluffy white and red spots, star in the center.
That's the one. Covers the key features.
And finally, stage 4.
Stage 4 is basically all the signs of stage 3, but with the addition of papilledema.
Swelling of the optic disc.
Swelling of the optic disc, yeah. It indicates really high intracranial pressure, often linked to malignant hypertension. It's serious.
Very serious. A mnemonic.
Swollen optic disc. The papa of all signs.
The papa of all signs. Okay, that paints a clear picture of progression. So let's back up the underlying cause, the etiology.
It's pretty straightforward, really. The main cause is chronic hypertension, just, persistently high blood pressure over time.
And that pressure directly damages those small retinal vessels.
That's right. It damages the vessel walls.
So who's most at risk then?
Well, obviously anyone with uncontrolled or poorly managed hypertension. The longer you've had high blood pressure, the higher the risk.
Makes sense.
And then factors that contribute to high blood pressure itself, like obesity, not getting enough exercise, smoking exposed shade, they all indirectly increase the risk too.
Right. So tell us a bit more about the pathophysiology. How does the high pressure actually cause this damage?
Okay, so the constant high pressure, it damages the endothelium, that's the inner lining of the blood vessels. This leads to the walls thickening and hardening, what we call arteriolar sclerosis. The vessels narrow.
And that leads to the signs we see?
Exactly. That sclerosis contributes to the AV nipping we talked about. The damaged vessels can leak blood, causing hemorrhages, or leak fluid and proteins, causing exudates.
And the cotton wool spots are from the reduced blood flow?
Yes, the ischemia. And in the most severe cases, the pressure gets so high it causes the optic disc swelling, the papilledema.
And it's a reminder, isn't it, that what we see in the eye reflects what might be happening elsewhere?
Absolutely. The state of the retinal vessels is often a good indicator of systemic vascular health, a window into the body, really.
Okay. Now, if you see these signs, are there other conditions you need to rule out? The differentials.
Definitely. Top of the list is usually diabetic retinopathy. It can look quite similar sometimes.
Right.
Also, things like retinal vein occlusion or other diseases affecting the blood vessels in the retina. You need to consider the whole clinical picture.
And how common is this, epidemiology-wise?
Getting precise UK prevalence figures is a bit tricky, but given how common chronic hypertension is worldwide.
It's going to be a frequent complication.
Exactly. It's commonly encountered.
So let's talk clinical features. What do you see during an exam, and what might the patient actually notice or complain about?
Well, during the fundus exam, we're looking for all those signs we discussed. The hemorrhages, cotton wool spots, maybe hard exudates too, the AV nicking, and in severe cases, papilledema.
And the patient, might they be asymptomatic?
Often, Yes, especially in the early stages. But as it progresses, patients might report blurred vision, maybe patches of vision loss, or even significant visual field defects.
Okay. And how do we confirm it? What investigations are key?
The absolute main thing is a good comprehensive eye exam, specifically looking at the funduses with the pupils dilated. That's crucial. We might use other tools too, like OCT optical coherence tomography to get detailed scans of the retina, looking for things like macular edema, and sometimes fluorescein angiography to look at the blood flow. And of course, you need to be monitoring the patient's blood pressure.
Absolutely fundamental. So once it's diagnosed, what's the management plan?
The absolute cornerstone of management is controlling the underlying cause, the high blood pressure.
So antihypertensive medications, lifestyle changes?
Yes, exactly. Aggressive blood pressure management is key. That might involve lifestyle advice, diet, exercise, quitting smoking, and usually medications.
And regular eye checks?
Essential. Regular monitoring by an ophthalmologist is needed to track the retinal changes and make sure things are stable or improving.
What about the prognosis? Does it get better if you control the blood pressure?
It often does, yes. The outlook really depends on how severe the hypertension is and, crucially, how well it's controlled.
So good control can stabilize things.
It can stabilize the retinal changes, and sometimes they can even improve. But if the hypertension stays poorly controlled, the damage tends to get progressively worse.
Which leads us to complications. What are the potential problems if it's not managed well?
Well, the most obvious is vision loss, which can range from mild blurring to severe impairment. You can also get complications like retinal detachment, macular edema, that swelling in the central part of the retina.
Which directly impacts sharp vision.
Exactly. Neovascularization, where abnormal, leaky blood vessels grow. Optic nerve damage, too.
And in the worst cases?
In severe, untreated hypertensive retinopathy, particularly stage 4, it can lead to permanent visual impairment or even blindness.
So it really hammers home the main message, doesn't it? Managing that blood pressure is just critical for preventing or controlling this condition.
Absolutely. That's the #1 takeaway. Control the hypertension, protect the eyes, and likely the rest of the vascular system, too.
Yeah. And thinking about that link, it makes you consider, doesn't it? Seeing these changes in the retina, what other systemic conditions might they point towards? It's a real window.
It really is. Something important to reflect on.
Definitely. Well, that brings us towards the end. For more great revision resources, do check out pastthemsra.com.
And also freemsra.com for loads of useful content.
Thanks for joining us for this deep dive.